We're going to cover a topic that has to do with millions and millions of people who get into pain. The pain may be unrelenting, give them no break at all, drive them completely around the bend. It can be there day and night. It can be so bad that you just can't carry on, can't live your life, feel like it's not even worth living. And some actually even take their lives for this problem. I've heard of such stories. But you can actually understand, and in understanding and knowing what to do, fix these problems. And we're talking about low back, disc, sciatic, and hip problems. So what are we talking about here? The bottom of your back, your lower back, an area that probably most people at one time or another may hurt in their lives, at least to some degree. But you can get into a point where you've really hurt it to a degree where it's really messing with you. It can completely limit what you do, what you can do, and even wreck your life. It may come from lifting wrong, it may come from a bad fall, it may come from a car accident or other type of accident, can come from sports injuries. And surprisingly now, the new cause of people with multiple low back disc problems is just people who sit all the bloody day. And they sit at work and they sit at work, and maybe they go out and try to become a weekend warrior and do a bit of exercise, and maybe the problem will happen then, or maybe it'll just come from the sitting. But oddly enough, that's where I find some of the worst disc injuries today, which wasn't the way it was when I first started practice. So what are we talking about here? We're talking about nerve problems that cause pinched nerve problems that cause pain in the low back. That pain may go down into your butt. It may go down, if it's sciatic nerve pain, it'll go down the back of your leg as far as it gets. We grade it if it goes to the bottom of your butt as being a lesser grade than if it goes to the middle of your thigh, that if it goes to behind your knee, than if it goes down to your calf, that if it makes it all the way down to your toes. But that nerve travels all the way down, and depending on how badly you pinch it, it will involve, in a sciatic pain problem, some part or all of that nerve. Sciatic nerve compression, which is called sciatica, can be the thing that drives people completely crazy. If you lift wrong, you can create pressure within the discs, and that's one way to get the worst kind of low back and sciatic problems. If you go and see a medical doctor, he can probably diagnose you and figure out what area of your back is in trouble, get the right images, do an MRI, magnetic resonance image that'll show the discs and show the tissues and see where the nerves are pinched. And if a person knows how to read them, you can actually find out what's happened to the nerves. But at the end of the day, what is your medical doctor, your orthopedist, your neurosurgeon, your neurologist going to do for you? Well, he doesn't want to go immediately into surgery maybe because he knows that's the most radical choice, so he goes to his other choice, drugs. So he's going to drug you with what? Painkillers, muscle relaxants, hypnotic tranquilizers, psychiatric drugs that are converted to pain drugs are some of the very strongest, and give you those to cover over your pain, and maybe you'll luck out and that'll take you through it. But that doesn't happen a lot of times. It doesn't happen, I don't think, even close to much of the time. Or he can decide to inject you. Put a big needle into your spine in the problem area and inject you with something that is mainly cortisone, the drug cortisone. And what happens there? Well, if you get lucky, the pain may reduce. Maybe it'll even reduce for some months. But whether you're lucky or not, that increases the rate of arthritic degeneration, which means that part of your spine is going to fall apart and collapse faster for having used that treatment. Is it worth it? Well, I just read an article the other day that listed the top 13 most stupid things you can do medically, and that was listed as one of them, getting an injection for nerve pain into your spine, all of which are going to be based on cortisone. Our testing, which we can do an MRI, and now the prices have come down where I can get an MRI run for only $300. It used to be $1,500 when $1,500 was a lot of money. Now it's $300 when $300 isn't a lot of money. And we can get it read by the best radiologists, which makes a big difference because knowing exactly which nerves are pinched, exactly what tissue is involved, tells us a lot about what we need to do, how we need to fix it, and what we can expect in terms of the time it will take and the job ahead of us. We add another testing system that your orthopedist cannot add, your medical doctor cannot add, because we do muscle testing where we can test the strength of your hamstrings, your hip flexors, your psoas muscles, other muscles, your butt muscles, your gluteus muscles. And we'll take 10 major muscle groups on right and left side and be able to know which nerve is pinched by which of those muscles is usually dead weak. Really bad cases, 8 out of 10, 10 out of 10 of them will be completely shot. Less bad cases, 1 out of 10, 2 out of 10 will be in trouble. And we'll know exactly where to look, so by the time I look at the X-ray and MRI, I know exactly where the problem is, and sure enough, that's exactly what the images show us where the problem is. But the nice thing is it tells us what we need to do, and it tells us when we've done it. So when I can take the pressure off that nerve, that muscle strength returns. And it's the first sign that you're getting better and healing, that you're getting out of pain, and that the thing is going to get well, and we'll do it without surgery. Now, their other choice is usually, if physical therapy may not do much for you, is to recommend to you a back surgery where they go in and cut. Now, they've gotten better at those back surgeries, and yet they still don't bring lasting results for a huge percentage of people, and they still backfire and leave people crippled and damaged who weren't that bad before the surgery and actually got worse. Yesterday, I talked to a patient who moved out of state and decided a surgery was a great solution, and they cut on her, and now her foot doesn't even work. She didn't have that problem before. She does now. It's almost impossible to walk, and that came from the surgery. What is the nature of a low back problem? You can pinch a nerve by moving a vertebra and twisting it onto a nerve, or the worst ones are disc problems, where the spacer pads between the vertebra have deformed in a bulge and pushing against a nerve, or the worst one where it's torn the fiber exterior and now the gel inside is squeezed out like toothpaste out of the tube and lands on a nerve. And that one is called a protrusion or a herniated disc, when the disc has been torn and the gel is pushed onto a nerve. What do we do in my clinic? I just took 2 patients this week who about a week and a half ago, both of them were so despondent they didn't even know if they could live anymore. They thought, I can't go on like this. If this goes on, I don't even know how I'll survive. And both of them were smiling, happy, back to the work. One of them composing music, the other one at her business doing work again, smiling and happy that they were getting better, and only in a period of about 7+ days were we able to make that change. To do that, we need very specialized disc chiropractic techniques, either using the wedge-shaped blocks, which helps us suck the disc back into place and with my hands guide the gel back inside the torn area, or using a flexion distraction table that can be used to in and out, bring the disc back into position as it flexes, and I use my hands to guide the disc back in again and then get it back into place. Then the outer tissues that hold the gel in place in a herniated disc have to heal. And to do that, we can use nutrition to speed the healing, cause the body to have everything it needs in the blood to be able to heal the tissue that's torn, put it back together fast, get rid of the damaged cells, clean the mess up, get the healing to be strong, fast, and get you out of pain. And we can use nutrition to actually reduce pain without the side effects of drugs. Why? Because we're using things that are natural, safe, and have no side effects. Drugs are usually unnatural, always have some safety consideration, and always have some side effects that you need to know that nobody usually even told you to look for. The other thing that happens in low back injuries is if you don't fix them well, they will degenerate into arthritic degeneration. The discs get narrower, the area gets more and more damaged, the nerves become more pinched, and as you get older, the whole thing becomes worse. I saw 2 patients in the last month who were only 50 years of age, but their low backs looked like they were 90 years of age. Almost all their discs were gone. I saw another 50-year-old in the same period of time whose discs were so perfect she could have been 24. Your spine can be older than your age or younger than your age, depending on how much arthritic degeneration took place. And that takes place when you have inflammation out of control, nerves that are pinched, areas that cannot move, and when they don't move, they start to degenerate. When we use these specialized disc techniques that most chiropractors aren't trained in, they don't want to take disc cases because they don't know what to do with them. But we do regularly take ones who can barely move, and every doctor's failed, every chiropractor's failed, and they're running around and getting on planes and flying places and doing things again. I've taken ones who were completely crippled, they couldn't do any work at all, and they're out playing beach volleyball. You can fix these people if you know what you're doing. You find out exactly which nerves are involved, you know how to read the MRI, you know how to do the muscle tests, and you know how to do the specialized techniques that are completely safe, non-invasive, no cutting, and know how to use the nutrition to speed the healing. And that's a beautiful thing.